mental health beds are coming to the Chippewa Valley after the authorized release of state funding. Katrina Lim spoke with the local hospital system that will be in charge of the new beds, as well as community health officials, on why this is such a game changer for our area.
On Wednesday, the State Building Commission voted unanimously to release $15 million for the expansion of mental health treatment beds at HSHS Sacred Heart Hospital in Eau Claire and St. Joseph's Hospital in Chippewa Falls.
We're really excited and honored that we have received this grant from the state of Wisconsin.
HSHS Executive Director of Behavioral Health, Tony Simonson, says they currently have 29 inpatient behavioral health beds at Sacred Heart, and this funding will allow them to add 22 more, making 51 total. 33 of them will be designated for adults at Sacred Heart and 18 for adolescents at St. Joseph's. However, Simonson says constructing these special beds usually comes with a hefty price tag, $1 million apiece.
Behavioral health beds have to have a lot of security in place, and we really need to make sure that the environment is very safe and it doesn't have like lots of tubes.
HSHS will be able to save some dollars by using existing infrastructure and renovating on the 4th floor of Sacred Heart, where the current behavioral health unit is, and utilizing a whole floor at St. Joe's.
We feel like we are not only meeting our mission by doing this, but also meeting the community need, which is very important to us.
Senator Kathy Bernier of Chippewa Falls was the author of a bill that helped put this item on the biennial budget and wants to see how these beds will help other facilities.
Winnebago has just short of staff, really struggling to keep up. And so I'm eager to find out the results once we get these beds up and running, how that's going to impact Winnebago positively.
Chippewa County Human Services Director Tim Easker says needing law enforcement to transport mental health patients is costly.
For counties, it runs us up to $1,350 per day.
So he says having these services nearby rather than hours away in Winnebago will be great for families and community partners.
This is going to allow for a better trauma-informed care practice. It's going to mean less trauma for those kids. Families are able to be closer. The transportation aspects, that everything is going to be much easier.
That was Katrina Lim reporting. More hospital beds does mean HSHS will be looking for more staff to hire, including nurses, psychiatrists, social workers, and certified nursing assistants. Administrators hope to have a more concrete timeline of construction plans after architectural designs for these beds and their spaces are complete. Officials say those designs should be done within a few months.